Chief Medical Director, Hospitals Management Board, Professor Abubakar Ali Kullima. So it's actually great to have you here today.
Thank you very much for having me.
All right. And compliments of the season.
Thank you very much.
Now, what informed this latest intervention in the healthcare system in Borno State?
I'm happy in your introductory remark you made a very good point by saying that Borno State is having one of the worst maternal mortality in the Northeast. And globally we knew the sub-Saharan Africa is having one of the worst health indices, even before the insurgency. And the 10-year-long insurgency has left the state with some dwindling, even health indices that we are battling with. And in view of this, we know all the consequences the insurgency brought over the time, both social, health, economic. But the health is the one that is the most devastating. And particularly maternal health, even before the insurgency, I say this is something very challenging. There are three critical things for us to minimize this, to improve the maternal health: access, availability of the health facility, and affordability. And then what informed the Borno State government's intervention is that they believe that once there are a lot of effort being made by government to ensure that at least they rebuild the health facilities, they employ healthcare workers, and then also provide the necessary drugs, equipment, and some other key facilities that are geared to improving the maternal health. And a lot of demands were created to allow these mothers to access the maternal health. But at the end of the day, the question of affordability is seriously affecting the access, the affordability of our mothers. And in view of this, His Excellency, the Executive Governor of Borno State, feel there is the need for us to make sure that at least maternal services are made free. Otherwise, maternal mortality that we are battling with, it will not be overcome. So in that direction, he graciously approved for free maternal health to all our mothers towards ascending antenatal care, include delivery, as well as even undertaking a cesarean section in that direction. So that's what informed the decision for His Excellency to intervene. As you know, Borno State, particularly after the insurgents, we have a lot of vulnerable. And most of pregnant mothers are the most vulnerable of those population that are affected by this insurgency.
All right, Dr. Kullima, the initiative going by those testimonies is a laudable one. What are your plans for sustainability?
Thank you very much for asking this very important question. The most important thing is not starting, but for you to sustain. And we believed with the effort Borno State government is making to resettle people. And then once people are resettled, we are now, the Borno is graduating from the emergency phase to now the recovery phase, or what you call the developmental phase. And once people are resettled and they begin their economic activities, the question of affordability they will now overcome these challenges of not affording healthcare services. And healthcare services generally is very expensive because the cost of things that are skyrocketing, it has equally affected cost of medical services. And then once they were able to recover from these post-insurgency, if they are able to recover from the economic challenges and they can afford, then this will also go a long way to make sure that at least we sustain this. We sustain these services for some time. The Borno State government is willing to continue for some time before people will have the economic capacity, to take care of these health challenges.
Okay, sir, can we know the number of hospitals involved and why only general hospitals?
For now, we are covering out of the 44 general hospitals that we have in Borno State. We are covering about 30 general hospitals that are functional now, and we intend to extend to all the 27 local government areas. Intend to extend to all the 27 local government areas, and also some primary healthcare centers that are in the densely populated, part of metropolitan, and Jere, specifically Yerwa Clinic, Mariam, Gwendamgari Primary Healthcare Center, Gulari Primary Healthcare Center, Fatima Alishir Primary Healthcare Center, and others, numbering about 10, are also part of this. Though they belong to primary healthcare, but they are also part of the beneficiaries of these, free maternal care services that we are rendering.
Okay, so I would like to know, how will the initiative transform and reposition maternal care system in the long run?
Thank you very much. I'm happy you also mentioned during your introductory remark that once the maternal health improve, once the health of the family improve, they say health is wealth. And then this is an opportunity for now to concentrate on improving their economic activities. And then once they were able to do that, what the family used to spend to provide maternal care services will now be spent on other aspects, either taking care of the children's education, or they will take care of their other needs. And they will even be, contented to start pursuing their agricultural activities and then improve on what the, family will, gain at the end of the day. And even mothers are now very active in backing themselves in economic activities. So once a mother can freely attend antenatal clinic and can have services, and she's healthy, she will have the opportunity, to also provide other means of sustaining her family.
All right, now, doctor, why the option of maternal care? And are you likely to expand the scope to accommodate other category of patients?
Thank you very much for asking these important questions. I say, why only on maternal care? Remember, for a mother to become pregnant, she has to be biologically, physically, mentally healthy before she becomes pregnant. And it is only in where we are taking care of our pregnant mothers, we take care of healthy people. Other subspecialties manage disease, we manage health. And at the end of the day, if we are able to, take care of these mothers, at the end of the day, it will improve, the economic likelihood at the end of the day transform into this. But if the maternal care if the maternal health care is not adequately addressed, it will even affect the other services that we are also rendering. And you likely say that why only concentrating on maternal health and not only other services? There are a lot of interventions that are now put in place to ensure that at least even other healthcare services are undertaken. But we don't want to bite much more than we can chew. So for now, we are only taking the maternal health, but the Borno State government is now taking the maternal health. And then not only this, there are also other aspects that is being sponsored by the Borno State government, particularly our chronic kidney disease patients are now having free dialysis services. Mm. Yes, and then those who are also with mental health are also having free, healthcare services. So it's not only restricted to maternal health, but because maternal health is the one that is disturbing, and then we want to make sure we...
So are you now giving us an affirmation?
Well, I'm saying, yes, I'm giving you affirmation that there are other services. And I'm sure in the long run, if we are not overwhelmed, I think graciously the governor will also approve for other sectors to also start benefiting from these free maternal services.
All right. Our best wishes to you in that regard.
Thank you very much, yeah.
And we must appreciate you for, being part of Panorama today.
Thank you very much.
Thank you so much. Thank you, and our best wishes once again.
Thank you very much.
All right, that was the Chief Medical Director, Borno State Hospitals Management Board, Professor Abubakar Ali Kullima.